Hi, everybody, and welcome to our spring community conference. My name is Chris Keck. I am the engagement campaign director for ImproveCareNow, and I'm going to be the MC tonight. So, walking from speaker to speaker, I'm going to present a couple of times our agenda for the night. Dr. Colletti, who's one of the executive directors and founders of ImproveCareNow, is going to start off the evening. We're going to hear a little bit from Carrie Ward, who's a parent from Children's Hospital of Orange County, and then hear about resources that the Patient Advisory Council has created. Hear a little bit about our parent working group and what they do. An update about one of our new research projects, Healthy Mind, Healthy You. Jill Horan from MassGeneral Hospital is going to share how they've built their team together. And finally, part of our team from our quality improvement department is going to share about a new initiative we have called Pathway to Mastery. And we'll finish off by talking about all the ways that you can get involved. I want to go ahead and say, the virtual community conferences are a great way to build community. There are folks on from all across the country, and I'm lucky enough to be right next door to a watch party. A group of parents, patients, and staff together in Cincinnati to watch together, plan how they're going to build their team here and what they want to do next. Great way to find concrete things to get involved. And then we hope that there is something for everybody on the agenda. And what we want to accomplish, we want you to your knowledge and awareness of ImproveCareNow to increase. We want you to be able to better describe the ways that you can get involved with the community. And then hopefully you'll hear something that you want to be involved with. And so as you think through, as we're going through the presentations, this is what we want to accomplish. This is how we want to be judged. So I'm going to go ahead and hand it off to Dr. Colletti, who's president and one of the executive directors of ImproveCareNow.
Thanks, Chris, and hello, everybody. I notice Maureen is on the phone as well from IHI. Welcome, particularly Maureen. It's a real pleasure for me to be speaking tonight. I'm not wearing a bow tie, despite what that picture shows. Next slide, Chris. And I'd like to remind you a little bit about where ImproveCareNow is in our development. We have 109 centers, including many, as you can see here, in 39 states and the District of Columbia. And next, and as well as in Europe. Advance the slide, please. It's animated. Yeah, we've got some in England, next, and Belgium and Doha, Qatar as well. Next slide, please. And our mission is to transform the health care and costs for all children and adolescents with Crohn's disease and ulcerative colitis by building a sustainable, collaborative chronic care network, enabling patients, families, clinicians, and researchers to work together in a learning healthcare system to accelerate innovation, discovery, and the application of new knowledge. A learning healthcare system is one in which patients and clinicians and others providing care to patients work together to choose care based on best evidence in an environment where research is a natural outgrowth of patient care, and in which innovation, quality, safety, and value are key to our functions. And we operate all of these things in real time. As a learning health network, we focus on improving outcomes, building our community, effectively using technology, and creating a learning system, which includes improvement science, system science, and clinical research. We use the model for improvement, in which the model for improvement and improvement science is quite broad and almost encyclopedic, but one of the fundamental precepts of it is that we establish our aim. What are we trying to accomplish? And then how will we know that a change is an improvement? How do we measure it? And what changes can we make that will result in an improvement? What are our hunches, or what does evidence lead us to believe that these changes will be effective? And once we've established these three parts of our aim and measures and intervention, then we apply the Plan, Do, Study, Act cycle. And a PDSA is a test of the change. We make the change, and then we determine whether or not the change is having a beneficial outcome. And most importantly, we connect. That's what we're doing tonight. We have a patient advisory council, parent working group. We have a listserv, a blog. We're on Facebook and Instagram and Twitter. We have an exchange in which we can contribute ideas, and part of our culture of we all teach and we all learn. And as part of that, we believe that everyone can contribute to improving care, not just clinicians, but all of us. As I mentioned, our culture includes the belief that we all teach and we all learn, and that we steal shamelessly but also share seamlessly. And we know that if you work alone, you can go fast, but to go far, it's necessary to work together, and that's what we do. And it's a very joyful experience. This is a picture on the screen now from 2007. This was our first community conference. We called it a learning session then. There were 28 of us, and most recently we had 10 times that number. So we continue to grow. We started with 8 centers, and now we're 109. And I think the reason we grow is because and there's a picture of from one of our community conferences. We grow because we provide value to clinicians, researchers, patients, and families, and they want to be part of our community. As I mentioned, we're 109 centers, and these centers have 950 pediatric gastroenterologists and 30,000 patients. And this is a little over half of patients cared for by pediatric gastroenterologists. And our aim is to go higher. The next. The most important thing is that there are, as a result of our working together, there are more kids with Crohn's disease and ulcerative colitis who are in remission. And what that means is they're feeling well, and they're functioning well, and they're doing the things that they want to do. This infograph shows some measures of our success. Starting from the top right, you can see that currently about 82% of our patients are in clinical remission. 97% are not taking steroids. 90% have satisfactory nutrition. The upper left, 94% have satisfactory growth. And I mentioned how many pediatric gastroenterologists we are, and there are all kinds of centers in ImproveCareNow. Based on the rankings of U.S. News and World Report, 44 of the top 50 children's hospitals or gastroenterology, pediatric gastroenterology centers are in ImproveCareNow, and 9 of the top 10 honor roll children's hospitals are ImproveCareNow. On the other hand, we have some small private practices that are intrinsically motivated and dedicated to improving care. Next, please. So this this shows how our clinical remission rate has increased. Back in April 2007, you can see the clinical remission rate was down around 50 to 60%, and it has continued to increase as we've taught the centers how to do, we've taught the centers improvement science and how to execute it, and provided tools to enable them to be more successful. And so now the remission rate is, well, most recently it was 81%. And improvement science is the foundation for achieving higher remission rates. Next, but we know that to go from 75%, which is where we think improvement science alone could get us, patient engagement and self-management and patient self-management improvements are necessary to get the remission rates higher to 85%. And to get even higher, we believe that better drugs and tests, clinical trials, new drugs and better tests will help us get closer to get over 90%. And we participate, and that does mean you, and that's why we're so glad you're on this virtual community conference. I think our next speaker is going to begin.
Yep.
Thanks, Chris, for giving me the opportunity to give a brief introduction.
Thank you. Thank you so much. We appreciate it. Carrie Ward is gonna tell us a little bit about her experience with ImproveCareNow next. Carrie, are you there?
Yes, I'm here.
Great. I'm gonna remute myself, and the floor is yours.
Okay, thank you so much. Hi everyone. I'm very excited to be here at the virtual community conference. Like you said, my name is Carrie Ward, and I am a happily married mom of 2 kiddos. Sarah, who's 16, and Ryan is 13. Sarah was diagnosed with Crohn's just 2 short years ago. Ladies and gentlemen, on behalf of our flight crew, let me welcome you to Dallas-Fort Worth. The time is 3:26 p.m. and is currently 68 degrees. After the hustle and bustle of passengers getting off the plane, I turned off airplane mode on my phone. Ding, voicemail, ding, voicemail, ding, voicemail. Hi, this is Chalk Hospital Surgery Center. I'm trying to reach the parents of Sarah Ward. We have moved up Sarah's surgery and need her to check in at 11:30 on the first floor of the main lobby. Beep. Next message. Hi, this is Chalk Hospital Surgery Center again. We are trying to reach, click. I hung up and immediately started dialing my husband. Oh man, I thought, I'm the main contact for Sarah. I knew I shouldn't have come to the spring conference on the same day she's having her procedure. What was I thinking? So, why did I leave my daughter on the day she was going under anesthesia? Well, I knew she'd be in good hands with my husband and my mom at home to spoil her after her procedure. And, well, Sarah made me come. She'd been through this procedure before and wasn't worried. She had seen firsthand how important these conferences are to continue to move forward to connecting families in our area. Besides, we'd been through far worse together. I would like to paint a quick picture of how Sarah was diagnosed. Due to her very low body weight and orthostatic tachycardia, her pediatrician said she should be hospitalized because her heart was struggling every time she stood up. Unbeknownst to my husband and me, she was admitted into the medical stabilization program for eating disorders. Those 3 weeks were life-changing. There was a surveillance camera that watched her 24/7. When she needed to use the restroom, we had to ask for a sitter to come in and watch her pee and poop on her bedside commode. She was not allowed to use a phone, cell phone, or computer, or read magazines. Only her dad and I could visit her, and she was bedridden due to her tachycardia, which meant even more isolation. Meal and snack times were nerve-wracking, especially as time went on. She had to eat all of her food in a specific amount of time, or she would be forced to drink Boost. But think about that for a minute. How would you like someone watching you eat, sleep, and poop 24 hours a day, 7 days a week, with no end in sight? You can't leave your bed except to go to the bathroom. You can't communicate with anyone outside of your room, and you have no idea when they will let you leave. I can definitely see this program working well for patients with eating disorders, but my husband and I knew in our hearts that she didn't have one. We fought from day one to see a GI specialist. After 2 upper GIs, a pill camera, and a colonoscopy with biopsies, they diagnosed her with Crohn's. It was not a diagnosis any of us were prepared for. But after weeks, which felt like months, we finally knew the cause of all her pain and weight loss. However, when we were able to take Sarah home, we felt lost, overwhelmed, and helpless. What exactly is Crohn's? How is this going to affect her at school? So many questions. When I did find answers, they were usually geared towards adults. After her diagnosis, I wanted to learn everything I could about the disease and how I could make her feel better. I started going to every support group in our area, combed through websites for information, and joined the parent working group. The parent working group has been fundamental in helping me step out of my comfort zone. We share selfishly and steal shamelessly each other's ideas. These community conferences, the conference calls, Facebook, and loop articles are just some examples of how the parent working group has helped me bring families together in my hometown. Since joining the parent working group, I've created a partnership with my CHOC IBD team. This partnership has allowed Sarah and myself to help with special projects to create a stronger IBD program at CHOC. For example, we helped create CHOC's IBD Road to Wellness Handbook, which we're very proud of. We also helped create a letter for patients to give to their teachers regarding special classroom requests, like being seated near the classroom door. I created the first official CCF-approved IBD parent support group here in Orange County. I've written a welcome email that I send to newly diagnosed families who have reached out to me. I introduce myself and I list how I got organized to better manage my family's IBD journey. I've gotten great feedback and heard that these tips have been very helpful. It has encouraged me to become more active in the IBD community by walking my first half marathon and raising over $2,000, as well as attending and raising money for Take Steps and Spin For events. All of these accomplishments have kept me from feeling helpless. And I believe I have helped other newly diagnosed families not feel as lost as I was. I believe I am making a difference in my community, and none of this would have happened if I hadn't joined the parent working group. The main goal I've set for this year is to bring more families together to share and support one another. My first challenge is to have at least one guest speaker at each support group meeting. My second and bigger challenge is to build small events for the patients to attend, while the parents are at their meetings. I have asked my CHOC team to help me move forward and make this happen, and I am very excited about this goal. Wouldn't it be great to have the kids in your area meet, say, every other month to connect and have fun together? Even if it's just to watch a movie or do a small craft. Last spring, when I was there in Dallas, Sarah's procedure went well. My husband was able to get her to the hospital in time for her to have her fistula seton inserted. Unfortunately, she woke up in a lot more pain than we expected, but our puppy gave her lots of puppy kisses and laid by her side day and night until she was up and around again. One of my favorite movies is called Meet the Robinsons, which has a quote from Walt Disney. It says, "Around here, however, we don't look backwards for very long. We keep moving forward, opening up new doors and doing new things because we're curious, and curiosity keeps leading us down new paths." So I encourage you to make a commitment. Decide to keep moving forward by creating a goal. We all have the ability to do anything. Read more books, take a class, and try new things in order to keep moving forward, to reach your goal. If you don't fail, you're not even trying. This group is a group full of leaders. Believe in yourself and great things will happen. Just keep moving forward. Thank you, and happy trails.
Next, we are going to go to Catalina from the Patient Advisory Council.
Hi, everyone. My name is Catalina Berenblum. I am a current senior, almost graduating at the University of North Carolina at Chapel Hill, and I am the PAP co-chair. So a little bit about what I want to talk about today. For those who are not aware, the Patient Advisory Council is a crucial part of ICN that's made up of patients who advise ImproveCareNow on all matters in relation to patient experiences. So I want to touch a little bit about what the Patient Advisory Council is as a whole. I want to talk about what the resources we create are and why they matter. I want to talk about how our resources can be used, and I want to talk about why patient engagement matters. Next slide, Chris. Okay, so who we are. We are mostly patients who are above the age of 14 at ICN centers. Right now we're limited to the United States, but we're hoping that we can get some folks from overseas at some point. We have approximately 60 members right now. We communicate entirely online, which is kind of a big hurdle to overcome for a bunch of teenagers, pretty much. We're half support group. We do support each other when it comes to IBD. We have a Snapchat group, an Instagram chat, all that kind of thing. And we're half a patient advocacy organization. So we go to conferences, we create resources for other patients, and we discuss in different groups within ICN about why the patient experience matters and how different clinical procedures and research procedures can be more patient-centered. We are made up of 3 different groups, so 2 co-chairs, Christian Lawson and myself. We have a communications team that does social media, so you're very welcome to follow us on Twitter and Instagram. We have an advocacy group that creates toolkits and resources for other patients. And we have a recruitment and engagement group that we're currently trying to grow that focuses on recruiting patients from other centers and making sure that we're keeping our engagement up. Next slide, Chris. So I just want to focus the majority of my presentation on what our resources are. So we spend a lot of time coordinating on calls and on Slack, trying to develop resources that are created by patients for patients. I've given you a little sample of a few of them here. One of them that I'm going to be talking about is the Crohn's and Colitis Storybook, which is essentially a storybook about different patients' experiences with inflammatory bowel disease. Among other resources, we have a travel toolkit which talks about traveling with IBD. That's especially relevant as we come into the summer. And newly released, especially for individuals who are on this webinar, we have the College and IBD Toolkit, which is an excellent resource for patients entering college. And I'll talk about that one a little bit later on. Go ahead, Chris. So I want to talk a little bit about why our resources matter, right? So we spend all of this time creating all of these resources, and for what? So I want to focus a little bit first on the IBD storybook, because I think it's an excellent example, especially for new diagnoses. This storybook talks about personal experiences of patients with different issues like self-care and education. A new IBD diagnosis can be incredibly isolating. So resources like the Crohn's and colitis storybook can help patients feel less alone. Imagine during your first year, a child being diagnosed with IBD. During your first clinic visit, you're told about this disease that you know nothing about. And then you're given a storybook that's full of faces of individuals who are going to share the experiences that you've already been having, who can talk about tips and tricks for managing them, and who can make you feel a little bit less alone in the process. We even went so far as to include the ages and locations of the people who are included in the storybook, just to make it feel as personal as possible. Most resources that IBD patients receive, especially upon first diagnosis, don't provide a first-hand outlook. They mostly just talk about like how to manage your IBD generally, but none of them really discuss the patient experience directly. So what we want to do is we want to make sure that patients feel less alone by actually connecting them, virtually at least, with other patients who have similar experiences as them. Next slide. So I want to focus a little bit on this page of the IBD storybook, which I think is really telling. A lot of resources are given to patients, and they are meant for both for the patient and the parent, whereas some of our resources discuss things that patients might not be necessarily comfortable talking about with their physician or with their parents. So something about, for example, how easy it is to discuss your IBD with your parents or guardians is really important for patients, especially because the disease can be so personal and so isolating. And this really emphasizes the importance of resources created by patients for patients that actually touch on the specific experiences that patients may have, both ones that they're willing to talk about and ones that they're not willing to talk about. We make sure it's incredibly accessible to families and patients by making the language familiar and accessible to kids of all ages. So I want to focus a little bit too on our college toolkit. So this is a new resource that we created that should have been sent to every participant on this webinar. But speaking personally, college is one of the most difficult experiences to manage with IBD. I came into college, I go to college 14 hours away from home, and I came into college already flaring. I had an abscess, and for better or for worse, I left home and decided to move 14 hours away to North Carolina, where my parents couldn't really help me. And I didn't know a lot of the things that this toolkit is actually providing. I scoured the web trying to understand what I needed to do to prepare for college, especially considering that I was so sick. And there wasn't really a resource that actually gave me all of the information I needed. So some of the things that this toolkit suggests that you do is to contact your school's accessibility or disability support services to set up a meeting to get accommodations, which are incredibly important to patients like me who flared and ended up having surgery halfway through my freshman year, only to try to stay in classes by completing all of my assignments from the hospital bed. So resources like this that actually are created through the experiences of individual patients are incredibly important because they make sure that all of the experiences that patients might have are actually put together in one document. And that is not necessarily provided by provider or center or other third-party created tools that are not based on especially patient-created patient experiences, in fact. So these are, all of the tips from patients who have been there, and it has a checklist format which helps patients feel a little bit more in control with something like college that can often make them feel entirely out of control. Next slide. So this is one of the things I wanted to talk about. I know that for a lot of patients, going to college is a time of a lot of stress, and it's really easy to be overwhelmed when it comes to all of the assignments that are being placed on you and meeting the standards of all of your classmates. And I would have really benefited from something like this my freshman year when I started taking all of these really difficult classes about Russian and policy and all of these things that I had never encountered before. And I ended up stressing myself out way too much and hurting my health in the process. So things like this that don't necessarily have to do with IBD, but are just helpful reminders of things that are beneficial to limiting stress in patient experiences are the kinds of things that are really important for patients. So not all of our resources are specifically having to do with medical things. They just deal with lifestyle generally. And things like, for example, conserving your energy for important things. So, I tried to do all of my homework in the beginning of the day because I was so anemic that I knew that I would be falling asleep by 7 p.m. at night. Taking a break would have been really important for me, but I didn't do it, and hearing these kinds of things from a resource that I'm getting that I know has been written by patients would have been incredibly important for my experience. Next slide. So this is another one that I think is really relevant. I picked some slides out of the toolkit that I think are really important. So balancing college and IBD is incredibly important. I recently had a conversation with a physician who told me that he tells his patients that they can do everything they want to do once they get diagnosed. And I told him, yeah, that's true, but there are some limitations that patients have that they need to take into consideration. So you don't want to get so overwhelmed with academics and a social life that you end up hurting yourself in the process, because once you lose your health, you aren't able to do absolutely everything that you want to do anyways. So things like considering how many classes you're taking is something that I learned the hard way. Now I try to take the minimum amount of workload that I can take to be a fully enrolled student. Not overcommitting myself is something that I also learned the hard way. Finding yourself struggling and asking for help, I think, is incredibly important advice, especially when it comes to reaching out to counseling services now that students are far from home and they can't necessarily rely on discussing issues that they're having at school with their parents, or having their parents there to help them to defend them against potentially teachers who are giving them incredible workloads that aren't sustainable for their specific situations. So those are just, some examples about why resources like this matter and why the specific suggestions that we give in these resources are especially relevant to patients, considering that they come directly from the patient experience, and really touch on things that are relevant to patients that they can benefit from hearing firsthand. Next slide. So I think a question that I get asked a lot, and I'm on a number of committees with ICN, I'm on the board of directors, I've gone to a number of conferences, and a lot of centers and parents have trouble incorporating resources, right? So kids these days are spending a lot of time online, and giving them a piece of paper isn't always necessarily something that they're familiar with. Simultaneously, I know that medical institutions are hard to manage, and bureaucratic issues are common, and incorporating new resources is often difficult. So one of the things that I think it's really important for providers especially to ask themselves, and staff members at centers, but also parents, is when you open your new patient folder and you give new patient folders to new patients, do you have any resources specifically for the patients, or are more of the resources oriented toward the parents? Are all of the resources just trying to explain what the diagnosis is, or are they actually discussing how to cope with a diagnosis? If not, some of the resources like the IBD storybook are a perfect suggestion for things to include in your new diagnosis packets. It's a beautifully produced high resolution document that all of your patients can benefit from. If you have an iPad in your clinic, you can show the resource to your patients on an iPad, or you can include it in their post-visit notes, a link to the resource, and suggest that the parents encourage the child to look at it. I think it's really important to remember, especially something with new patient folders, that it's the child's diagnosis, not the parents. And while the parents and the families are definitely being impacted by the diagnosis, ultimately, they don't have the bodies who are suffering, and they are not the ones who are going to have to cope with a new diagnosis directly for the rest of their lives. Another thing I wanted to touch on is that Do you have, children or patients who are asking questions about a specific experience? So the web is a great resource for a lot of things, but often, especially advice about IBD is spread out over multiple websites, and it's difficult to find specific patient experiences about different issues. So travel, for example, is something I get asked a lot. I lived in London for 6 months, and a lot of people want to know how the hell I did that, considering that I'm on a biologic and how I managed my insurance and all of the rest. And that's the kind of thing that our travel toolkit can help children and families to understand. It's really important to not only provide parents advice about the technical issues of insurance and about medications, but also to provide children advice about how to deal with their diagnosis in a number of situations. One of the resources I think that's especially important about this is we have a body image toolkit. I think body image is a issue that's not necessarily touched upon with a lot of patients and parents, and it's something that patients might feel especially uncomfortable talking about. So if you notice that some of your patients are having negative self-confidence issues in relation to their bodies, or if you realize that your child is feeling uncomfortable in their own skin, it might be a good opportunity to provide them with the body image toolkit, which is a specific resource that has patient experiences for dealing with body image issues. And so we not only have resources like the IBD storybook, but we have resources like the college toolkit, like the body image toolkit. We have an ostomy toolkit, a travel toolkit. All of these resources are specifically for specific questions that patients and parents might have, and that your children might ask you if you're a parent as well. And it's really easy to get our resources to patients. So patients spend a lot of time sitting in waiting rooms and clinic rooms and infusion centers. And while I understand that some clinics don't necessarily have complete ownership of those spaces, potentially before patients enter a clinic room, when they are deposited there by the nurse, there can be a binder with our resources that they can look through. So you have a big binder and it says IBD resources on the cover, and patients can leaf through it while they're waiting for their provider to walk in. And I'm sure that leafing through our resources can lead to a lot of questions that can help fuel a healthy discussion during the clinic appointments. The same can be said for infusion centers. A lot of patients wait for their medications for multiple hours. And while Netflix is definitely a good time-passing opportunity, it might also be a good chance to have them look at resources that can help them feel much less isolated about their illnesses. Next slide. So I want to talk a little bit, and I think this is really important, about why patient engagement matters. So I was diagnosed with IBD when I was 11. I'm 21 now, and I, at first, didn't really feel comfortable at all talking about my diagnosis. In fact, I often said that I was a broken machine. I used really negative language. I was scared to go to advocacy organizations and do any kind of advocacy work because I wanted to be normal. And I wanted to suppress all of these negative feelings I had about my body and about myself as much as I possibly could. It took, going my freshman year to college 14 hours away, having 3 surgeries while still staying in school, and seeing that there's a lot of isolation that comes with having this disease, and seeing that I could use those negative experiences that I had to make a positive impact on the lives of other people. So I think patient engagement is fundamentally a symbiotic relationship. So not only are not only are providers benefiting by increasing the standards of their practices by including patients, but patients are benefiting by being able to take something that's inherently negative in their diagnosis and making it something positive. And most patients, some might feel apprehensive about engaging in advocacy work and engaging with the clinic in a way that they're not familiar with. But I think, especially if they're asked, a lot of patients will feel more comfortable doing this. Patient engagement can also improve the clinic experience. So I participate in my center's weekly ICN meetings and provide my perspective on different issues. I mostly talk about, multidisciplinary care, and I comment sometimes on our hospitalized patients. And I really want to make sure that the clinic experience is as beneficial as possible to patients, especially as providers don't necessarily know what it feels like to be in a clinic room as a pediatric patient. I've also participated on a number of study protocols, so like the Produce study and a number of others, and I think the patient experience can help a lot with recruitment in making sure that any recruitment materials and policies are as optimal as possible to make sure that patients are actually willing and able to sign up for your studies. It also increases patient self-management. I feel a lot more inclined to take care of myself because I'm taking my negative disease and I'm making it something positive. I've learned so much about my illness this way, and I now know so much that I basically feel like I can almost treat myself. Obviously I don't, but the self-efficacy and the self-confidence that gives me makes me feel much more in control of my diagnosis. Patient engagement and family engagement is also a way to connect families and build a community within your organization. So you have a lot of families that are coming in and out of centers and in and out of clinics who don't necessarily know each other, but they can definitely benefit from learning about each other's experiences. And getting them in a room together and building an advisory board is a great way to create a community within your center, and then engaging them in ICN is a great way to build a community nationally. So how should you engage patients? So the first thing you can do is sign up for Circle. So the Circle is a great resource. It's a newsletter that you can get about everything having to do with ICN. The Patient Advisory Council gives a lot of updates on the Circle to make sure that everyone is informed regarding new resources that we are releasing. You can also find every resource that I've talked about and more online. So I highly encourage you to give them to your kids and patients. I know a lot of kids are kind of apprehensive about looking at a lot of these kinds of things, but I would encourage you to print them out and then sneakily leave them around their bedroom. And I promise you at some point, they're likely to look through it and learn a little bit from it. Something I also encourage patients and parents to, or patients to do, and encourage parents to encourage their children to do, is to join the PAC. I always like to tell the story that, ostomies are really difficult to have around and out in the open for a lot of patients. But whenever we go to conferences together, there's at least a couple of patients who have ostomies who are very comfortable having them out while we're sitting in a room together and just hanging out. And I think that really demonstrates the importance of spending time with other individuals who have your disease, and joining a PAC is a great way to do that. I also would say that on a local level, it's really important to advocate for your patients to get involved in QI meetings, especially your patients who are over the age of 18. We found that it's not that difficult to get patients HIPAA trained. And if you are a parent or a patient at a center, I would encourage you to ask your provider about getting involved in QI meetings, because most providers would be more than willing to incorporate parents and patients more in their QI work. Next slide. I think that's it. Yep. All right. Thank you so much.
Well, good evening, everyone. My name is Jill Horan. I'm the co-lead for the Parent Working Group, and wanted to thank the PAC and Kat in particular for such a great presentation. I think it underscores the importance of stakeholders in improving care, and so we're so privileged to have such a dynamic group of patients who are willing to work together to really improve care. What I'd like to focus on now for just a moment with my friend Maria is that we're going to be going over what the Parent Working Group looks like and how you can get involved and feel empowered to help improve the care of your patients and your families. So just a little background, the Parent Working Group is a group of parents and guardians of children with Crohn's disease and ulcerative colitis. We're really committed to enhancing the quality of life for our children and other families that live with inflammatory bowel disease. I think the key part here is that not only do we want you to exist with it, we want to empower and help you thrive to really reach your full fruition and have your kids reach their full potential. Next slide, please.
Hi, ICN. Hello, everybody. I'm Maria Tribble, calling in from Northern California. I'm part of the Parent Working Group, and I'm responsible for securing presenters for the monthly Parent Working Group All Calls. What are Parent Working Group All Calls? Well, let me provide a few key elements. The presenters are comprised of the Parent Working Group, PAC members, ICN personnel, and clinicians. These 1-hour calls range in topics relating to IBD. The calls are vital in keeping the parent working group connected to one another, as well as being a valuable resource tool. It's like a mini tutorial monthly, and you get to network with other parents every month. We hear the latest information regarding research, toolkits, events at care centers, just to name a few. And as you can see, we hosted quite a few interesting topics, and there is more to follow. This month, focusing on accommodations, and in June, just in time for summer, advice on summer travels with IBD. One of the presenters that comes to mind is Dan Hecking, calling in from Sweden at 1 o'clock in the morning to present his app called Pling. Once you've received an email from ICN about an upcoming all call, all you have to do is RSVP. ICN makes it so simple to navigate the RSVP process. Reminders will be issued as well at least a few days before the all call. I hope you can join us for a future all call. My name and email is located in the Parent Working Group directory. And if you have any ideas or topics for an upcoming all call, I'd love to hear from you. Thank you.
Hi, this is Jill again. So what are the opportunities for getting involved? So you can join our monthly webinars. The other thing that we do is a family newsletter, so you can share your thoughts in the newsletter. Join a subcommittee. So we have lots of really exciting projects that we have going with our research committee, membership, trying to get other folks to join us, the communications committee, and you can connect with us on Facebook at ImproveCareNow Parent Workspaces. I think the big thing is that there's a huge benefit of getting involved with other parents. You know, you share this experience, and it's hard when you're feeling a little isolated that other people may not understand what you're going through. I think the strength of the parent working group is that we're all in the same boat, and we're all trying to navigate the best, for the best interest of our kids. And so these are opportunities to really feel empowered and to make change. So we would really encourage you to join us and help us as we move forward in our mission. Next slide, please. So these are a couple of links that you can use to get involved. The Parent Working Group sign up is www.improvecarenow.org, connecting-parents, and the other links here as well. And also Chris Keck, who is our staff liaison, is also a good resource if you have any additional questions about what the Parent Working Group is all about. But we really encourage you to be part of this, be part of the change, feel empowered to be more than just passive recipients, but rather empowered to be active participants in your child's care and really making change to improve care for not only your family, but other families as well. Next slide, please. So again, this sort of sums it up that, being so happy to connect with everybody. There's really passionate people who are looking forward to trying to improve care for folks. And again, we invite you to be part of that journey with us. Next slide. Thank you.
Great, thank you, Jill. We are going to actually hear now from David Wolh, who is going to talk about a research study that ImproveCareNow is taking part in right now called Healthy Mind, Healthy You. Dave?
So I'm a parent. I'm at the University of North Carolina, like Catalina, and I'm a parent of a now 15-year-old boy with young man with Crohn's disease, and have been very active in the parent working group, in the research subcommittee, and at our local site. And really just an honor to be in this lineup of really fantastic speakers. I'm just going to take really like 2 minutes to tell you about one of the studies that are being highlighted. As Chris mentioned, we have numerous studies that are planned and in the works, but also some that are already happening within ICN. Research is so important, and when we talk to parents and patients, people who are affected on multiple levels, they say research is important. So we've got to walk the walk, not just talk the talk. So here's an opportunity when we ask people also about their priorities. Coping, as Catalina mentioned, and dealing with stress is really up there at the top, along with better therapeutics and management. So this is a really interesting study that is going to answer, hopefully, a really fundamental question about mindfulness. I think most people, it's one of those things you kind of know what it is, hard to describe, but it really is living in the moment and appreciating things just as they're happening. And so being present is something that is not fundamentally easy for most people, and it takes a little bit of training. But once you get it, like snowboarding, you're there and it's there for life. And so this is a study that's looking at 2 different strategies for teaching mindfulness, sort of a more intensive 8-week program versus a shorter 3-week program. It's involving centers throughout ICN and beyond. It's an 8,500 person study trying to enroll not only people living with the conditions, chronic conditions that can be stressful, but also their caregivers, including parents. So 8,500 is a big number. So we're expecting a lot of involvement from different people, from different walks of life, from different sites, including every ICN site. So on this slide, you can see a little bit more about that. You have to be patients who are over 18 years of age, so we're not looking for younger children in this particular study. I think there is an important question to be answered in younger individuals. This is really looking at a little bit older people. So this is going to be geared towards a lot of the older patients, transitioning patients, and also parents and caregivers. So I think this is really important if you're interested. The website, if it's not working right now, it will be shortly. There was some issue with the website, so today it may not work. Try it tomorrow. But again, I think showing that we really care about research by joining research studies is incredibly important. So I'll stop there. Thanks.
Thank you so much. If anybody has any questions about Healthy Mind, Healthy You, please feel free to reach out. It's a study that we're really excited about. Up next, you all just heard from her, but she's gonna be on stage again. Jill, who is one of the co-leads of the parent working group nationally, is also the co-lead of their parent and patient advisory team at MassGeneral Hospital for Children. And they've spent the last year building a guidebook for how to build patient, family, and clinical partnerships at the local level. And I want to turn it over to Jill. Jill, are you there?
I am. Thank you. Can you hear me okay?
You can, and if you just want to let me know when to advance the slides, I can move them along for you.
Okay, terrific. Thank you, Chris. So thanks, everybody. I appreciate having the opportunity to speak to you again. So just a quick overview. We were the proud recipients of the first Parent Innovation Award last year. And so our year-long project really was chronicling our journey to engagement. And so one of the things that we felt really strongly about is that as a center, we wanted to make sure that all stakeholders were represented and that we had this cohesive team. The problem was we didn't know how to get there. And so there's been some wonderfully successful efforts up until this point from other centers. And when we went to community conference, we always felt like we were missing a piece of the puzzle, that they had these really dynamic teams and somehow we just didn't know how they got there. And so that's really what our journey was about. And I would like to underscore that we were definitely building upon the work of other folks who had gone before us, looking at engagement, looking at putting together some preliminary manuals on that. And so our journey is the next chapter of that. But we hope that you take what we've done and build your own and add to our chapters, because I think that's really where the power of ICN comes, when all the stakeholders can come together and work as a cohesive team. So we can go to the next slide, please. I don't have, unfortunately, any financial disclosures. Okay, we could probably zip through that. Okay, next slide, please. So we're going to jump to point of view. So usually when I do this, it's an engagement opportunity, so I'll have to pretend you're in front of me. But imagine looking at one of these little paper cups. And what I would normally do is ask people what they think it is. But for our purposes tonight, I would like you to put in the chat box what you think that object is. So I'm just going to take a moment. This is the participatory part of the program. So if you could just take a moment and chat in your little chat box what you think that object is. Right, I see some great responses. I see things like ketchup cups, medicine cup, a cup to take a pill. Anybody else? Last minute? Another pill cup. So the interesting thing is I did this project with a variety of different folks. Took this little object, I passed them out, they were on everybody's table, and I looked at it and I said, what do you think this object is? And then depending on the response, depending on the group, I got different responses. So I did this with a group of teenagers and they looked at it and almost universally, they said it was a ketchup cup. Yet I did it with a group of GI physicians in a grand rounds kind of situation, and they all universally said it's a medicine cup. And so I thought it was a really interesting perspective that we look at the same object, but we look at it in a very different way. So we could go to the next slide, please, Chris. So the interesting thing about these cups, for our purposes tonight, we're going to think about it as a ketchup cup. And so whenever I use these ketchup cups with my kids, I would typically use 5 or 6 cups because the ketchup never, it seemed like you never had enough ketchup. And then of course, once you dip your French fry in the cup, it spills all over the place. But what I didn't realize is that, see those little intricate folds of the paper cups? Well, they're actually designed to be unfolded and flattened out as you see in the picture here so that you can dip your French fry. And the point of this is, these little ketchup cups have been getting a bad rap for a long time. These little ketchup cups had so much untapped potential, yet we were looking at them in a completely wrong way. And I think the same could be true for when we think about our care centers, that we have such untapped potential when we're not collaborating, that once we unleash that, we can really accomplish so many amazing things. Next slide, please. So why collaborate? Next slide. Because the reality is we're better together. Next slide. So when we think about collaboration, nothing can replace the value of the lived experience. That patient activation is the core principle of Wagner's chronic care model for improved outcomes. So if we look to the right, there's a little illustration here. And so we look at our community resources and policies, and we look at our healthcare systems, and we look at all these various components, but then they sort of narrow down into the red arrow there, informed activated patients. All of that is a critical, important piece of the ultimate improved outcomes. And so ICN has really bought into this model and really shown that we really need to have activated stakeholders in order to truly improve outcomes. Our data suggests, though, that there's a significant opportunity to build more stakeholder collaborations within the ICN network. And studies suggest that as a result of this patient activation, we're going to be able to achieve better results. And so that's why we went about doing this project. Next slide, please. So let's first, we got to start at ground zero, right? So you got to assess the center's readiness to collaborate. And so when you think about, going in and having conversations with your physicians, if they're not ready yet to collaborate, that can be a challenge. So I would say if there are any centers on the phone, providers on the phone, and you're interested in collaborating with parents and patients, that it's normal for staff and clinicians to be both excited and anxious about involving parents and patients in the improvement work, but that it's a paradigm change, and change is hard no matter how obvious the potential benefits might be. And I think that you have to identify and acknowledge and address that within the team, and address any concerns early in the process to really develop a meaningful collaboration. Because if people are not ready for that, if they don't understand the benefit of that, and you haven't worked out those issues, it's going to be really hard to partner. Okay, next slide, please. Collaboration requires a shift in a new way of relating to each other. It's about partnering on equal footing to address gaps in care and opportunities for improvement. And each stakeholder assumes a shared responsibility to ensure the success of tasks and goals. And I can't underscore that enough. We have these relationships with our providers. It definitely is a different kind of paradigm switch, that you wear a different hat. And so at the community conference, I talked about this because, the idea that parents and patients can then be partners in terms of improving care is a huge paradigm switch, because oftentimes you're pigeonholed and seen in only just one way. And so I think about how, as a female, as a woman, I wear many hats. I'm a mother, I'm an administrator, I'm a volunteer, I'm a wife. I can assume many different hats, and I think we all have that we can share, and we can be lots of different things. And so in this instance, our individual parent hat needs to be put on the side, and then we work on behalf of all patients and families. And so it is a little bit of a paradigm switch. Next slide, please. So what kind of, as a center, recognizing who do you reach out to? So really we want to be looking for other parents who value the lived experience, recognize the value of the lived experience, develop people's own existing capabilities. So you might know a family, or you get together at an event and you recognize that somebody is really engaged. Those might be people to reach out to. You want to promote mutual aid and reciprocity. You want to break down barriers between care providers and parents and patients. And I think the most important thing is to listen and communicate well. Next slide, please. So what do those parent partners look like? They're proactive and engaged with their own health care. They accept and respect the HIPAA process, because that can be a big challenge. They're clear about the values and aware of that others might feel differently. See beyond their own experience. And again, we talk about that individual parent hat, and then we're working on behalf of all patients and families. So we look beyond our own experiences. We look to build consensus and compromise and collaborate on solutions. And then, you got to have the time and the resource and the experience and the knowledge and the will to really be able to dedicate this time. Listen well and ask questions. Again, respect diversity and different opinions, and can build relationships and a rapport with others. Next slide, please. So once you have parent partners, what happens? Next slide, please. Well, without an effective support structure, the team will struggle to function. And quite frankly, that happened to us. So our journey began in January of 2016. We had a group of physicians who were really interested in partnering with the parents and patients, and sent out a letter. We had a focus group. We created these great committees, and everybody was really gung-ho. We had about 18 parents, and then it was crickets for about probably 8 to 9 months. And so the reason for that is because there wasn't an infrastructure there to really get us beyond that brainstorming phase. And so my cautionary tale would be to be sure that you build that strong foundation, because otherwise your house will end up like this one here in the slide. Next slide, please. So creating team expectations and goals is really an essential element to that. Once a cohesive team is created, it's important to set expectations and goals. And then really considerations should be given to the team's bandwidth and how they'll work together. And that's, I would say it's probably one of our biggest challenges, because you need something done, you ask a busy person. And so every person on our team is involved in multiple other things, working full time, having families, having, children with chronic diseases, etc. So we need to figure out how are we going to work together, and what's the best way to achieve our goals. Next slide, please. So things to talk about with your centers and with your parents would be the best way to communicate, for example. Do you set up regular conference calls? Is email the most effective way to do it? Is it an in-person meeting, etc.? What kind of tools will be used? Again, will you be doing virtual meetings like what we're doing today, or will you be using the email or set up regular scheduled things? How often will the team meet? How will projects be determined? What's the expectation on attendance and support of the programs? Do you expect the providers to be there, all of the providers, some of the providers? And then the big one is finances and fundraising. How do you get the money to really be able to promote your programs and really be able to facilitate those? So those are all considerations that need to be part of the conversation when you're setting those expectations. Next slide, please. And then I think the next thing you want to do is goal setting. And the thing about goal setting is you can start off small, and that's exactly what we did. I think, we were intimidated when we went to the initial conferences because, again, we had these really dynamic centers doing this incredible work and these just well-oiled machines. And we looked at that and we were just completely intimidated. I think, it's okay to start small. And the small might be, you know what, we're going to set up a group email so that if we get parents that are interested in joining our engagement group, there's a place for them to email. We want to create your own sort of database management programs. Well, you don't want to create it, you want to use one. So MailChimp is the one that we use. NationBuild is another. You want to recruit other patients and families for part of your center's engagement group. The thing that worked really well for us is a creation of an annual programming plan broken down into months with key dates and deadlines and programming ideas so that we filled in all of those blanks. And that really became our roadmap to how we were going to move forward with our programming. And then the other piece of this that's really important is that you want to collect data along the way so that you know how to best respond to the needs of your families. So SurveyMonkey was one of the tools that we used, and we would use it both for pre-program surveys as well as post-survey evaluations, just so we learned how to improve our programs and see where those opportunities lie. I think the big thing though is that you want to have smart goals when you start off and throughout the process, because that will help move you along the continuum of improvement. You don't know where you're going unless you can measure where you've been. And so I think those are great opportunities to really use the tools that we use throughout the ISAN conference in a meaningful way to really be able to track and be able to measure your efforts and how that's impacting the patients and families within your centers. Next slide, please. So the nuts and bolts of program planning. You want to establish a budget. You want to agree on a date, often driven by when the presenters and space is available. Secure a space for the program, secure your presenter, advertise and market your program. Again, you can start small and build upon your success. Collection of data is an important way to learn about the effectiveness of your programs. And then I think it's a really important component of this to offer both social and educational programming, because really what we're talking about is building a community, a sense of community. And so those opportunities of just time just to get together, just to chat with other folks is an essential part of building those relationships and making those connections. And out of that, just the most organic friendships and strength and support grows. So I can't underscore the importance of just doing those things. I think a lot of centers struggle with finances and understanding, like, how do we pay for these things? And so that in and of itself can be a great start to your programming efforts. So there's two schools of thought, and I think one of the things you want to think about is, how can we enhance the center's success? Although some people don't like fundraising, fundraising is a really great opportunity to build collaboration and to build support within your center and build value of that parent, patient, and center relationship. So a lot of hospitals have, I would say every hospital has a development department where their sole responsibility is to raise money for the hospital. I would encourage you to speak with your providers to be able to collaborate with the hospital's own development office, because they'll have a plethora of opportunities and fundraising ideas to help you as you move your programs forward. The other thing, especially if it's a nonprofit hospital, is sometimes they can give you letters and you can get in-kind donations. So for example, Costco, if you have a letter stating that you're a nonprofit institution such as a hospital and you're doing a program for children, they may allow, with that letter, you can get donations for refreshments and things like that. So check out those local opportunities, work with the development office. A lot of them have fundraising toolkits, and that's a great way to collaborate with both the providers and your hospital and add value to your center. Next slide, please. So marketing your programs, and this is, we definitely did a boots on the ground kind of approach. And so our physicians have been incredibly instrumental in helping us build this sense of community. And let's think about it for a minute. Pharmaceutical companies spend millions of dollars influencing physician referrals, right? So if you have your physician and you're partnering with them, one, engage them to do your programming for you. Listen, they're the experts. That's why we're bringing our children to them. And so there could be an area of expertise that they would like to do a program, an educational program around. So that's one of the ways to engage with your physicians. The other thing is give those programming flyers to your physicians and have them hand invite their patients, because they're the ones who are going to be seeing the patients. That face-to-face invitation from the physician has far more significance than a flyer up on a bulletin board or even an email. So I would strongly encourage you to work with your physicians to be able to help promote your programs that way. But in addition to that, you know, you do need to promote in passive ways through bulletin boards and flyers, the listserv emails. A lot of the centers have patient portal opportunities, so you can send out emails through the patient portals. The patient gateways, word of mouth, these are all ways to be able to promote your program. One word of note, so because of HIPAA, we couldn't just be given a list of all our IBD families. And so we needed to be able to give opportunities for the patients and families to contact us. And so that's the reason why you want to have your database email set up, so that there's a way for when families are responding, RSVPing for these programs, they'll email to your database, and then you ask them to be added, if you can add them onto your database listserv, and that's how you start to build your community. Next slide, please. So if you build it, they will come. And this harkens back to that movie, Field of Dreams. And so the idea behind it is that we're building this really amazing collaborative community, and that this is really our field of dreams. Next slide, please. So what are the benefits of engagement, community engagement? Well, these are just comments that we've gotten from some of our evaluations, but I think it's truly speaks to the ability of the power of our community. Thank you for your support and caring. It helps a lot. Thank you. Such a relief to have a support team. I'm so glad the boys came and had such a good time with other kids. Thank you for organizing this event. My daughter has found it helpful to be around other kids who understand what she's going through. We'll be contacting our legislatures regarding pediatric IBD safety registry. These are all examples of empowered, engaged parents and families, and this is really what the crux of what we're trying to do. This is the benefit of this engagement community. Next slide, please. So what we're trying to accomplish here is really an extension of what the physicians are providing. We know that patients and families live with IBD 8,760 hours a year. We know that on average, our physicians are only able to spend approximately 3.5 hours a year caring for your patient, caring for your kids. And so we need to be able to complement what they're able to provide, to really provide holistic care for those parents, patients and families. So from shared experiences grow strength, resiliency, and support. The educational programs increase the knowledge of the diagnosis and empower patients to better manage, cope, and thrive with their disease. Through engagement, patients and families become active participants rather than passive recipients of care. And again, studies suggest that high patient activation is associated with remission in patients with IBD. These are all really compelling reasons to really grow your engagement community. And these are great ways to, you know, as you're building that relationship with your providers, these are really concrete benefits of how you're going to help enhance care within your center. Next slide, please. And again, we can't lose sight of why we're doing this, which is quality improvement. The purpose of the collaboration is to improve outcomes. It's important to measure and analyze your results from each program, utilize the QI tools to help, and then use your data and lessons learned to create new SMART goals for continuous improvement. And because really, truly, that's what we're trying to do, but we don't know, you know, all change isn't good, and we don't know if what we're doing is truly improving care. So what we want to do is make sure that we're using those QI tools and those fundamentals to make sure we're moving along that improvement continuum. Next slide, please. So want more information on how to build a collaborative network? Well, if you can check out our parent-patient engagement manual on the ICN Exchange. And again, I would be remiss if I didn't say that this was a collaborative effort with all the folks who came before us, and so we owe a debt of gratitude to them for all the work that they had done and the foundations that were laid, because they enabled us to build on their work. And again, we encourage you to build upon what we've created to build something even bigger and better. Thank you so much. Really appreciate your time and efforts.
Thank you, and we very much appreciate you presenting tonight. Mary is our next presenter, and she's going to talk about the pathway to mastery. And before she does, I want to say, pathway to mastery, one of the things that I found really cool about ImproveCareNow when I started a year and a half or 2 years ago is this idea of a learning health system. And that, you know, when somebody, and it's part of what we're doing here tonight, when somebody learns something new that works in Massachusetts, you know, it gets that information to the people in California and in Oklahoma and in Florida as quickly as possible, so they can implement those changes, and we all can improve faster together. And fortunately for all of us, ImproveCareNow is one of the leaders in that field. A lot of the work that we do is first of its kind, or way out in front of everybody else. And so, with that said, I want to pass it over to Mary, and Mary works on quality improvement with ImproveCareNow, and she's going to talk about the pathway to mastery. And this is how we've come up with and what we're doing to make sure that everybody in the network is learning as quick as possible, so that we can improve care as quick as possible. Mary, are you there?
I am here. Can you hear me okay?
We can. Take it away.
Wonderful. And thank you for that introduction, Chris. And yes, to your point, the pathway to mastery not only helps us to disseminate the information as quickly as possible, but it also helps to increase that co-production and that engagement, and really values the engagement efforts of the parent and patient working groups. And so I'm going to talk a little bit about that and give you all a little bit of an overview of how the pathway to mastery came to be. And so some of you who were at the community conference or even prior calls may have heard of this term, or you know, there may have been a buzz in the air about it. So hopefully I'll give you a good baseline, and we'll talk about how you all can get involved along the way, because we need your help, absolutely. So next slide, please. Next. All right, so just to give you a quick overview of the pathway to mastery, it is reorganizing to improve, build capacity, and generate new knowledge to close those gaps in outcomes. As Chris had mentioned previously, ICN, they really are the innovators to improving outcomes and care for our kids with IBD. And people look to us to be the experts in this area, and, you know, really be able to disseminate this knowledge on a large scale. So this is what we're looking to do, is just do a better job of it. Next slide. Brief history of ICN. So when ICN started, it was a smaller group of care centers and organizations, kind of like your street when you first move in a new neighborhood, maybe a new build, and there's just a few of you on the street. So the first part with ICN when they first started was to really look at improving the processes. And then just a few years after that, they recognized, okay, we're improving our processes. Now let's focus on those outcomes and the chronic care management. Next slide. So after they got a few of those pieces down, they said, you know what, this is pretty good. So let's move into the suburbs. So ICN started growing, much like the suburbs expand. And so their model kept on expanding with that. So they adapted open source methods and to build this community, which included things like the research and innovation that we heard about earlier, to build peer production networks, advanced technologies, and then also begin comparative effectiveness research. Next slide. But like all good things, that was not good enough with ICN. And so that suburb continued to grow to one of the new innovative communities where you have access to any needed resource that you may have, or any resource that you may need, and really a collaborative effort with the community, with sustaining the community, and making things better for everyone within that community. So starting about 2015, really starting to focus on that engagement, innovation, and research. Scaling up the engagement, the network redesign to utilize learning labs to retain that community feel. Some of you may have been involved in those learning labs previously. And then infrastructure development for patient-centered research. Next slide. Some of the celebrations along the way, due to all of the hard work and tremendous efforts of everyone in collaboration on ICN, you can see here on the first slide to your left is the percentage of patients in clinical remission. And this was starting in 2013. And you can see that over the course of time, ICN's network made great gains with their care centers to get everyone up and really make great improvements in that sector. The other piece here is, as you can see on the right hand, as we were making gains in improving clinical remission, we were also adapting new care centers. Adopting new care centers. And we are currently about 109, 110 care centers, last to my recollection. Next slide. All right, so what were our learnings and what were some of our challenges? Some of our learnings, we know that we have to focus on outcomes. While focusing on outcomes, continue to work on building processes, tools, and structure to enable the sharing and collaboration. Again, maintain that community feel within the learning labs that we have developed and really make that sense of commitment, ownership, and belonging to that community. And then also engage all stakeholders. More participation equals more capacity, more customized resources and activities. So again, as that neighborhood expanded to one of those innovative neighborhoods where you have all the resources available, that's really what we were looking at with ICN, is building that capacity, having the resources available for all of those that are able or part of the ICN network. Some of the challenges. We're looking at achieving better outcomes. ICN has made great gains. However, we still need to improve upon some of the outcomes. In addition to that, looking at uniformity with those outcomes. Some of the challenges still lie within center diversity. It's harder to deliver value to all based upon the diversity at the centers. Resources at those centers vary from center to center. Patient populations even differ from center to center. So recognizing that although, yes, we all do provide care to patients with IBD, it doesn't mean that we're all starting from the same point. In addition, there's financial challenges, and then also identifying and implementing new knowledge and addressing the social disparities and outcomes. Next slide. All right, so back in January, we started the process, the redesign process. And what we attempted to do was create a framework that we were able to share at the community conference to get everyone's input on. And so during this session and brainstorm that we had, we talked with various centers at different levels to identify the needs and the vision of the future. As I said before, this is really where the concept and the framework of the Pathway to Mastery came about. And then looking at planning for new trailblazer communities. And those are, it's all very exciting actually, but the trailblazer communities, we'll talk a little bit more about with the engagement piece as well. Next slide. Okay, so one of the pieces that that I spoke of previously was about the improving outcome and improving care. As you can see here, there definitely is a no-do gap where we need to better execute. So although the centers are making improvement, making gains, what we see here is an area of opportunity to continue making these gains to get centers to be greater than 80% remission rates, increases the number of centers that have that greater than 80% remission. Next slide. All right, so Pathway to Mastery design requirements. And again, just kind of go over some high level pieces here and what the Pathway to Mastery focused on. Obviously outcomes that matter most, and really focusing in on the remission and sustained remission piece. The content and support tailored to center performance, so really making it center specific, giving centers the opportunity to say, hey, this is what we really need most at our center to continue to excel and to move forward. It really made no sense to put a variety of offerings that did not meet the center's needs and didn't tailor to their needs. Centers making sure they have access to organized modular change packages linking to outcomes such as the remission and the sustained remission, and provide opportunities for leadership development. Revitalize the QI coaching and peer-to-peer learning. That was a really big piece of this, and look forward to doing more of the QI piece with our leaders, with our parent and patient work groups, and multidisciplinary team. And then also to strengthen and focus on new knowledge. And that's where the Trailblazer piece comes in, on how can we leverage this new knowledge and really be ahead of the game and really be the ones that others learn from here at ICN. So lots of great positive energy. All right, so that being said, some of you may have seen this slide before. This is a visual graphic of what we have for the pathway to mastery, and then the identified learning labs. So during the community conference, we came in with a basic framework, knowing that we had 3 pathways and then our Trailblazer teams. The 3 pathways we came in with were foundations, so looking at the registerable population, making sure that centers had at least 75% of their patients registered into the ICN network. So that was pretty much the base foundation, the starting point. Those centers that have achieved that then go on to looking at achieving remission. And that is we're looking to get greater than 82% of their patient population within remission. And then that leads to achieving sustained remission. So greater than 55% of the patient population achieving sustained remission. So back to that being very outcome focused, and making sure that we are providing support to our centers so that they can achieve the best outcomes possible, and then build upon each level. So if you're new, let's say you're new to the ICN network as a care center, the expectation, and may or may not be right away, we want to make sure that you have the foundation pieces in place and that you have the tools available so that you can continue to improve your patient care in a strategic manner. The next piece here is the Trailblazer teams, and we're looking at there's more of the innovation pieces, and I'll talk about those in a minute, but that's really where some of the innovation comes from, and those pieces are still under development. As you can see at the bottom there, we have that purple arrow. So along these pathways, there is a constant focus of the multidisciplinary team, which includes parent and patient engagement, psychosocial support, and nutrition therapy. And so we want to make sure that all of the players are at the table with this pathway to mastery, that we are doing collaborative learnings, and that everyone has value to add to this pathway, and we want to make sure that everyone's voice is heard. Next slide. All right, so with our Trailblazer teams, we're focusing on new knowledge. So we're still in development of these communities. So still a little bit under construction, as you can see, but right now those communities will be focusing on engagement, and then transitions of care, looking at doing some regional ICN groups, as well as clinical research process improvement, and then also clinical standardization. Some of the components that are in more of the planning stages include the surgical management of IBD, the autoimmune hepatitis, and then continuous monitoring symptoms with the PROS, the pharmacokinetic dosing optimization, and then also the social disparities and outcomes components are also in the planning stages. So lots of great ideas came from that design day, and now we are just trying to figure out how to work them all in. Next slide. All right, so as we move forward with our pathway to mastery learning structure, as I had just described, we have our pathways, which is a framework across the system to drive outcomes. Our KDD, also known as our key driver diagram, we use that, and each pathway has a key driver diagram. This is our theory of change to drive the outcomes across the centers and in the pathways. And then how we're going to do this is through those learning labs. The learning lab structure has changed a little bit from what it was previously, but we're still using the opportunity of the learning labs to get teams together to have those collaborative conversations and collaborative learnings, looking at defining the SMART aims and alignment for the learning labs within the pathway here. So that gives you a basic overview of the structure. Next slide. And then the framework here. With the learning labs, and this is really where the work occurs in helping centers get to the next level. Really focusing on an integrated approach that includes the quality improvement consultant, project management, parents, patients, leadership from the centers, all supporting the learning labs to move the work forward. Each care center, back there, thank you. Each care center is asked to choose a pathway based upon the center analysis of their strengths and opportunities. There was some data given, or there's data that each center has available to them, and based upon that data, it helps them choose where their greatest, where they will benefit most from starting. And so they have been asked to choose a pathway, and then also choose a learning lab within that pathway. When a center achieves the outcomes goal and can sustain results, they have one of two options. They can stay in the pathway and join a new learning lab, or they can progress to the next level in the pathway and join a new learning lab in that next pathway. And then centers will also have the opportunity to change learning labs and pathways twice a year. We'll be doing a lot of work around this at the community conference and doing some assessment leading up to the community conference if centers are ready to switch pathways and continue their learnings at another level. Next slide. The expectations of the learning labs, it really, if we don't have a collaborative effort where teams are truly participating and actively participating, we will not be very successful. So we do have a set level of expectations for the teams participating in this collaborative work, that they do attend monthly calls, and that they also do participate on the network-wide quarterly calls as well. In addition, we ask our teams to work on PDSA testing, and if that's a new term to you, that's Plan, Do, Study, Act. It's one of the methodologies for it's a quality improvement method, basically test of change. And we ask centers to work on these various tests, at least 1 to 2 per month, so that they can, it's the rapid cycle learning, and we want to share those learnings with the other teams during our learning labs. And so again, it's very collaborative, and that's probably from the time with quality improvement work, that is, you know, you can read a lot of articles, you can read a lot of research, but when you're on a team with others, other organizations throughout, you know, your state or your country, even your own city, learning from their experiences and some of their challenges, it's really such a tremendous value. I can't express that enough in helping you see things in a different light, and something that you may have thought wasn't possible before now becomes a little bit more of reality and being able to accomplish. The last 2 things would be to review the data on a monthly basis, and then also narrative reports that come out. And then I know Chris was really anxious to get to this next slide because everyone's going to be able to give him a call to say that they want to be engaged in the Pathway to Mastery. So if you want to learn more, or if you want to become involved in this work, you know, I can't say this enough, and I want to emphasize what Jill and Maria and Kat said earlier. Please get involved. Please reach out to your care center and ask them how you can be involved in the work. And if you know you feel that you may not be able to have that opportunity to do so, reach out to Chris and say, "Hey, Chris, I want to get involved. You know, where do I get started? How can I do this?" Because we really, in order for us to improve outcomes and move this work forward, we need your help. And that's what's so great about this engagement piece. This truly is very innovative work. You know, there's not a whole lot of people out there doing it with this co-production and the collaborative efforts that are going on here with this ICN network. It truly is amazing. And I've been on the network for a short time, but I'm very impressed and very excited to be part of this work. So.
Mary, thank you so much. That was fantastic. I'm gonna move I'm going to move to ways to participate. And I'm going to try to do this without the PowerPoint slide. And I'm going to try to share my video. I don't know. Can y'all see me? Can somebody give me a heads up if my face is on the screen and if it looks way too close to the screen? I don't know if you can see me. I'm here with some folks. You can see the people in the background. Say hi, everybody. This is a watch party in Cincinnati, and I just wanted to say there are lots of ways that you can get involved. One, now you know what the face looks like behind the voice that's been talking to you all night. But also there are lots of different ways that you can get involved. Check out our website, ImproveCareNow.org. You can, if you go to the Get Involved section, you can see how to sign up for the Patient Advisory Council Parent Working Group. We're on all of social media. There's a special page for parents, a parent working group page, and a page for patients. And then we have our own main site where we post videos of presentations like this, also updates about the network. Finally, I would say, part of the way that community organizing works is when people are reaching out to their friends and neighbors, they're more likely to get involved. And so my ask for you by next week is to find one person who isn't involved with Improve Care Now yet, and to ask them to get involved. Everybody moved out from behind me. There are a lot of folks here tonight in Cincinnati because they did that exact thing, and I would encourage you all to do it too. Thank you so much. We appreciate you joining. Look out for a follow-up email where we'll be asking for your feedback so we can do better next time. Thank you to everybody who presented. Have a good night.